Did you know that osteoporosis can be developing in your body without you even realizing it? Most people believe that osteoporosis is something that only affects older people, or that it manifests itself in obvious ways, such as a painful fracture. But the truth is much more complex. The problem is silent, often without significant pain at first, and only reveals its true severity when it is already advanced. Osteoporosis can start imperceptibly, and many people, without knowing it, are already at risk, leading to irreparable consequences. Osteoporosis is a disease that weakens bones over time, making them more fragile and prone to fractures. At first, it doesn't cause any pain or obvious symptoms, which can make it easy to ignore. However, the initial signs can be subtle and often go unnoticed, such as mild back pain or a feeling of tiredness when doing everyday activities like lifting or walking for long periods. These symptoms are often attributed to age or wear and tear on the body, but they can be the first warning sign that something is wrong. People often get used to this discomfort, not realizing that it is one of the first signs of a bigger problem. Osteoporosis develops silently, but its effects can be devastating. Did you know that you can start losing bone mass before you even feel any pain? This means that you could be heading towards a critical condition without even knowing it. And by the time the more serious signs appear, such as spontaneous fractures or difficulty moving, the damage may already be irreversible. Imagine the frustration of discovering, after a fracture, that your bone density had been compromised for a long time, and that you could have prevented or slowed down this process with an early diagnosis. If you feel any kind of pain or discomfort in your back, joints, or when performing simple movements, it may be time to pay more attention to your body's signals. What seems to be just a passing discomfort may, in fact, be the first symptom of a disease that affects millions of people around the world, without them even knowing it. It is essential that you are aware of the early signs of osteoporosis and what to look for in your body so that you do not let it go unnoticed. Information is key to prevention and early treatment of this condition that can impact your quality of life. Don't let osteoporosis come as a surprise to you. In the next topic, we will explore the early signs of osteoporosis, the ones you should be aware of to detect the disease before it takes over your body. When we talk about osteoporosis, most people imagine severe pain, fractures, or the inability to perform simple tasks. But the reality is that osteoporosis can start much more discreetly. Most of the time, its initial signs are so subtle that people don't even realize that anything is wrong. That's why paying attention to the small details of your body can make all the difference. One of the first signs of osteoporosis can be back pain, which appears gradually and is often not directly associated with weakening of the bones. It can be a pain that comes on over time, intensifying over the months, but without an apparent cause. Many people attribute this discomfort to stress, work, or even old age, without realizing that it can be a warning sign that bone density is decreasing. If you already feel some type of pain in the lower back, it is worth investigating the cause. Another common but often overlooked sign is loss of height over time. This is a symptom that can occur due to the weakening of the vertebrae, which are compressed by the lack of bone mass. If you notice that you are getting shorter, or that your posture is altered, this could be a sign of osteoporosis. The compression of the vertebrae can affect the spine, causing a curvature known as kyphosis, which results in a more hunched appearance, as well as pain and discomfort in the back region. Many people also begin to feel a sense of weakness in their legs or arms, as if they don't have enough strength to perform simple tasks, such as carrying bags, lifting objects, or even walking for long periods. This is because osteoporosis not only affects the bones, but can also affect muscle function, as fragile bones provide less support and therefore require more effort from the muscles to perform everyday activities. This feeling of weakness is another sign that osteoporosis may be developing silently. Additionally, have you noticed difficulty bending down or getting up from a chair? Or perhaps even a little effort has resulted in unusual discomfort. These types of difficulties can be more than just a sign of aging. Movements that were once simple, such as squatting or standing up without assistance, can become challenging as osteoporosis weakens your bones. This discomfort in your joints and legs may indicate that your bones are no longer as strong as they once were. If you've noticed any of these signs, even if they're subtle, don't ignore them. They're your body's way of letting you know that something's wrong. Osteoporosis doesn't appear overnight. It develops slowly, and the sooner you recognize these signs, the easier it will be to treat it and prevent more serious complications. In the next section, we'll explore the common symptoms of osteoporosis and how to identify them before they become irreversible. As osteoporosis progresses, its effects start to become more noticeable, and it is at this stage that people usually realize that something is wrong. However, because it is a silent disease, the first fractures often occur without a major immediate impact, which can cause people to underestimate the severity of the problem. Recognizing the most common symptoms is crucial to preventing osteoporosis from developing further and leading to serious complications. One of the most noticeable symptoms of osteoporosis is an increased propensity to fracture, even in situations that shouldn't result in injury. Have you noticed that you're breaking bones or twisting an ankle more easily than before? Or perhaps a simple stumble could have led to a fracture. Osteoporosis weakens bones so significantly that a minor fall or even a sudden movement can result in serious injury. When this happens, it's time to investigate your bone density and see what might be causing the fragility. Another common symptom is persistent back pain. If you experience chronic pain, especially in the lower back or thoracic region, that doesn't seem to go away with time, it could be a sign of weakening of the vertebrae. People often mistake this pain for a muscle problem or even wear and tear due to age. But in fact, it can be one of the first signs that the bones in the spine are being affected by osteoporosis. Compression of the vertebrae can cause constant pain and even affect posture, making the spine less flexible. Gradual height loss is also a common symptom that often goes unnoticed by people. It may not be something that is immediately noticeable, but over time, it can become more noticeable. Osteoporosis can cause the vertebrae to compress, causing them to become smaller and resulting in height loss. If you notice that your clothes are getting longer or that your height has decreased over the years, this could be a clear sign that your bones are weakening and you should seek medical help to assess your bone health. Additionally, muscle and joint weakness can be a symptom that many people don't directly associate with osteoporosis. When bones become weaker, the body requires more effort from the muscles to compensate for the lack of support. This can result in feeling tired more quickly during physical activities and even difficulty performing simple tasks, such as climbing stairs or walking long distances. This excessive fatigue can be an indication that osteoporosis is affecting your mobility, making activities that were once simple become challenging. Finally, increased stiffness and difficulty moving is also an important symptom. If you have started to notice that your movements are more limited, whether it is when bending down, standing up, or turning your neck, it may be due to osteoporosis. Bone weakening can lead to changes in the joints, which result in increased stiffness and physical limitations. This symptom may be mild at first, but over time it can become disabling, making it difficult to perform daily activities and affecting your quality of life. If you identify with any of these symptoms, don't ignore what your body is trying to tell you. Early diagnosis is key to preventing serious fractures and improving your bone health. In the next topic, we'll discuss the consequences that can occur if osteoporosis is left untreated and why prevention is always the best course of action. Osteoporosis, if left untreated, can have devastating consequences, permanently affecting your quality of life. What starts as a silent problem can become a real obstacle to your daily activities, impacting not only your mobility, but also your physical and emotional health. Ignoring osteoporosis and allowing it to progress without proper treatment can result in frequent fractures, loss of independence, and even serious complications. One of the most visible consequences of untreated osteoporosis is bone fractures, especially vertebral compression fractures. The vertebrae in the spine can become so fragile that even a simple fall or sudden movement can cause them to break, causing severe pain, deformity, and even loss of the ability to move properly. These fractures can severely limit your mobility, resulting in constant pain, discomfort, and the need for expensive and time-consuming treatments. In more severe cases, these fractures can lead to a loss of quality of life, with the person becoming unable to perform even simple tasks, such as getting out of bed or walking to the bathroom. In addition to fractures, osteoporosis can lead to other serious complications, such as curvature of the spine, kyphosis, which is often associated with loss of height and a hunched posture. This occurs due to compression of the vertebrae, which become thinner and more fragile as the disease progresses. Kyphosis is not just an aesthetic issue. It can affect breathing and digestion, as the curvature of the spine can put pressure on internal organs, making breathing more difficult and impairing the mobility of the diaphragm. People with severe kyphosis may experience shortness of breath, difficulty eating, and even problems related to the digestive system, in addition to a negative perception of their own image. As bones weaken, so does the risk of falls, which is a critical factor, especially for older adults. A simple slip or trip can result in fractures that would otherwise be preventable in a person with healthy bones. This creates a cycle of fear and insecurity, where the person avoids physical or social activities, which only further exacerbates muscle weakness and loss of mobility. Over time, falls can become more frequent, and the constant fear of injury can lead to social isolation, contributing to poor mental health. Another serious consequence of untreated osteoporosis is the impact on mental health. Chronic pain caused by fractures and bone compression can result in anxiety, depression, and loss of self-esteem. Living with the constant worry of getting hurt, combined with physical pain, can trigger a series of emotional problems. A feeling of dependence can also arise, since the person affected by osteoporosis may need help to perform simple daily activities, such as getting dressed, taking a shower, or even leaving the house. On top of all this, untreated osteoporosis can mean significantly increased medical costs. Fracture treatment, hospital stays, surgery, and rehabilitation can all add up to a significant financial expense. Ongoing treatment with medications and physical therapies may also be necessary to improve quality of life and aid recovery. If osteoporosis is diagnosed in its advanced stages, treatment may be more difficult, time-consuming, and expensive, and may require prolonged rehabilitation. Therefore, the consequences of osteoporosis are serious and can affect every area of your life. Don't treat osteoporosis as a distant or inevitable problem. Early treatment is key to avoiding these complications. In the next topic, we'll discuss how you can take action now to diagnose and treat osteoporosis before it causes irreversible damage. Now that you understand the devastating impact osteoporosis can have on your life, it is crucial that you take immediate action. Early diagnosis can change the course of the disease, preventing fractures, deformities, and loss of independence. Don't wait for more severe symptoms to appear to seek help. The sooner you act, the more effective the treatment will be, preventing complications and improving your quality of life. The first thing you should do is see a doctor to perform specific tests, such as a bone densitometry, which measures the mineral density of your bones. This test is quick, painless, and highly accurate in detecting osteoporosis, even in its early stages. If you are over 50 or have risk factors, such as a family history of osteoporosis or prolonged use of medications that affect bone health, this test should be part of your regular health routine. Additionally, your doctor can develop a personalized treatment plan that may include lifestyle changes, calcium and vitamin D supplementation, and even bone-strengthening medications. Adopting healthy habits, such as a balanced diet rich in essential bone nutrients, is essential for preventing and controlling osteoporosis. Regular exercise, especially activities that help strengthen bones, such as walking, dancing, and weight training, is also a cornerstone of treatment. Osteoporosis is not a death sentence, but a condition that can be managed with proper care. If you are having difficulty moving, experiencing back pain, or are concerned about the health of your bones, don't wait any longer to take action. See your doctor, get the necessary tests, and follow the treatment guidelines. The key to preventing the serious consequences of osteoporosis is awareness and early action. Don't put off until tomorrow what can be done today. Remember, osteoporosis doesn't have to be a death sentence. With the right attitude, you can continue to live a full life without the limitations that osteoporosis can impose. Taking action now is the most effective way to ensure a healthy, active future. Take care of your bones before it's too late. Now that you understand the seriousness of osteoporosis and how it can affect your life, the message is clear. Don't wait for symptoms to get worse. Osteoporosis is a silent condition, but that doesn't mean it's invincible. By taking action quickly, you can prevent it from developing to the point where it can cause irreparable damage to your bones and your health. The power is in your hands, and prevention starts now. The actions you take today, such as getting regular checkups, adjusting your diet, exercising, and maintaining a healthy lifestyle, are key to ensuring that you keep your bones strong and healthy throughout your life. Don't let osteoporosis come as a surprise in the future, something that could have been prevented. Your body gives you signs, and by recognizing them, you'll be one step ahead and taking control of your health. Remember, the first signs of osteoporosis may be subtle, but don't ignore them. Simple back discomfort, weakness in your legs, or difficulty moving around can be the first warning signs that your bones are weakening. If you identify with these symptoms, don't delay seeing a doctor. Early diagnosis is the best way to control the disease and avoid serious complications in the future. Osteoporosis is treatable, and prevention is key. By adopting healthy habits, getting regular checkups, and following recommended treatment, you can not only reduce your risk of fractures and injuries, but also ensure that you can live a more active life without limitations. Don't wait until you're in excruciating pain or have a broken bone to take action. You can start taking care of your bone health now. Now is the time to make the decision to take care of your bones and your health. Don't let osteoporosis take over your life. Prevention is always better than cure, and action today will make all the difference tomorrow. Take care of your bones so you can continue living the life you deserve, with freedom and without restrictions. Don't put it off. Schedule your appointment today and start taking care of your bones now.